Involving the patient in disease management is a central tenet of collaborative care and crucial for patients with interstitial lung disease. Shared decision-making is a method of communication in which clinicians and patients work together to make optimal healthcare decisions that best align with the goals and preferences of patients. In addition to pulmonologists and primary care physicians, nurses, physical therapists, respiratory therapists, nutritionists, and palliative care professionals play integral roles supporting patients across the course of the disease, from diagnosis to end-of-life care. Actively seeking your patient's participation at initial diagnosis is essential for patients to be fully engaged in their disease management. They must be well educated about their disease state. Arrange a time to meet with the patient, caregivers, and family members that allows adequate time for questions and discussion. Provide educational materials and resources in different formats to meet the needs of the patient and their families. Help your patient explore initial treatment options and develop a treatment plan, always keeping in mind the patient's values, preferences, and goals. A discussion of realistic treatment expectations is essential. In addition to antifibrotic therapy, comprehensive IPF management includes risk factor reduction, staying up to date with immunizations, monitoring and management of comorbidities, exercise, pulmonary rehabilitation, nutrition, and supplemental oxygen is needed. For some patients, participation in a clinical trial may be an option, should your patient be considered for a lung transplant. Use the teach-back method to confirm that the patient understands the options, including potential risks and benefits, and can explain his or her options and in his or her own words. At each follow-up visit, evaluate the current treatment plan. Have there been any changes? Is the patient taking medication as prescribed? Is the patient having any difficulties with the medications? Having an open dialogue will allow you to work together to optimize medication use. Strategies for managing side effects may include adjustments, such as when the patient is taking his or her medication with or without food, or in some cases, dose titration may be necessary. An ongoing collaborative relationship continues over the course of the patient's disease, and changing needs may occur during the lingering phase of disease. This ongoing, patient-centric approach helps ensure that patients are supported in making informed decisions, including end-of-life care, all while optimizing quality of life.